Hi, my name is Claudia Baker, and my persuasive speech is how CNAs should be paid more. Have you ever had a loved one that went to the hospital to stay overnight, or even a family member that your family couldn't help maintain their care and were moved into a nursing facility? Have you ever thought about the workers that took care of them? A certified nursing assistant is an essential worker in their care. Well, they stay in a nursing home or a hospital. A lot of people have never really thought about what happens in the background of hospitals or nursing homes. There is also so much that goes on, and I'd like to tell you about it in the context of a CNA. The nursing community has so much weight put on them to take care of their residents or patients to make sure they are getting the best care possible. And most of the time, it is pretty taxing on them. The healthcare professionals are always there to make sure their patients and residents are properly clean, fed, and entertained while they are at the end stage of their lives, or even at the hospital where they need time to get better. For starters, I would like to talk about the work that CNAs provide in a clinical setting. They are there 24/7 providing care to their patients. In a nursing home, they are bathing the residents, and that can be rather challenging depending on the mobility of the patients. Some can't use their legs or arms due to medical conditions, or even just being elderly and have lost mobility function. CNAs do have tools to help them in these situations, but most of the time it's pretty labor intensive. Not even just only for the showers though. They need to get up and out of bed and move around during the day, so CNAs are required to get them up and down multiple times a day. Another thing in the nursing homes is that they want them to be up and moving about in the facility as much as possible, so the CNAs will need to get them up for meals like breakfast, lunch, and dinner. They can't stay in bed during these feeding times because it's a risk for aspiration. In a hospital setting, they will need to be sitting up at least in bed or in a chair. CNAs are also there to make sure that they attend things like bingo, and they also are allowed to go on outings with the facility, so they need help getting ready for those things. Sadly, they are in a facility because they can no longer help themselves, so we physically have to help them get dressed and what they would prefer, and that's easier said than done. Another thing is making sure that the residents are never sitting in their own urine and stool. Most people that are in facilities are incontinent and have trouble knowing when they use the bathroom. CNAs are required to make sure that they are cleaned up every 2 hours to ensure that they don't get skin breakdown and infection. CNAs will learn their residents' routines, being a part of their activities of their everyday life, knowing what their favorite snack is and if they like milk or water with dinner, knowing if they are diabetic or not, also knowing if they require a certain diet because they can't chew anymore or swallow correctly because of a stroke. The CNA also has so many roles in their residents' and patients' lives. It's really a jack of all trades. The conditions that they are set up to work in can be very difficult challenge. There are so many things that have to be done at a certain time, and keep in mind what is more critical and needs to be done first. Always putting the needs of their residents and patients first. CNAs aren't always given proper staffing, and it seems like there is not enough CNAs on a floor at a time. Oregon does have a patient ratio for CNAs, and it is 1 CNA to 7 residents for day shift, then 1 CNA for 9 residents for evening shift, and 1 CNA for 17 patients during night shift. I know this seems pretty reasonable, but some residents need more care than others, and that always isn't split fairly. Oregon states that the ratios are intended to improve patient safety, reduce medical error, and improve working conditions. And I would like to say that yes, the ratios do help. CNAs are not compensated for the taxing work that they do. An example of a tough worker barrier is that CNAs are told to ration on supplies for each patient or resident, saying that there is a limit on how much of something we can use. In some cases, residents need more adult briefs than others. A lot of the time, CNAs are given what they get, and they have to figure out their own game plan on how to eliminate the tasks given. A CNA does work aside nurses, but don't always get help from the nurses. CNAs always experience high turnover rates due to low wages, which realistically means that they are paid significantly less than other healthcare professionals like nurses, like which leads to job dissatisfaction and tendency to leave their position. Another thing I would like to touch on is that CNAs are required to accept when they sign up for a job that they will miss out on holidays with their families to be with residents. It may not be every staff, but it's a good chunk of them that are employed. I believe that after all this information I provided, if you would be able to help make a change on the fact that CNAs needed to be paid more, you would consider that they do in fact. With all that being said, the hard work that CNAs do and including the working conditions, they should be paid more. CNAs feel as if they aren't getting fully compensated for their work, and it has led them to leave the healthcare field, which impacts family, residents, and employers. It quite literally takes a whole team of effort to be in a healthcare field, and CNAs feel as if they do not matter and will lead to less and less CNAs in the long run. If you're not taking into consideration the CNAs, think about the loved ones that could be having to be placed in a facility. Think about the care and the compassion they need. And I would like to say that I also have an audience, which is my coworker, Nicole.
Hi!